Hello and thank you for joining OBN Horn of Africa. This is our weekly program, special edition, and I'm Fanta producing this program. Today I am at Haramaya University HiwotFana Specialized Comprehensive Hospital to meet doctors working in this hospital, and there is also Dr. Artist Alibura Cancer Treatment Center. We will get in together and observe the works that they do and discuss with them this cancer that is killing many people over the world. Till the end of our program, stay with us. Let's get inside together. Hello, Dr. Abdi.
Hello.
Good afternoon. I'm good. Thank you very much. Would you receive us?
Yes, welcome to the historical city of Harar, the historical honored higher institution of Haramaya University. This is an Harar campus with University Hospital.
Thank you very much. Before visiting this center, we will have some discussion with Dr. Abdi Amin, Haramaya University Comprehensive Specialized Hospital Chief Clinical Director. Till the end of our program, stay with us. Doctor, nice to meet you.
Thank you very much. Welcome. Most of the journalists don't come to Harar. You are one of the few one who come. So we are very happy. We are pleased to have you in this historical site.
Could you give a brief history of HiwotFana Hospital and Dr. Artist Alibura Cancer Treatment Center, please?
When you start from the Haramaya University in general, it was established as agricultural college in 1954 with Oklahoma State Universities. So through time, just around 27 years back, it established College of Health and Medical Science. And actually, it was only health science previously, but in 60 years back, it started the medical school, School of Medicine, teaching School of Medicine. So it occurred the hospital that we are in, HiwotFana Hospital. The HiwotFana Hospital was established in around 1928, when the 1928 to 1936, in between the Italian, according to the Ethiopian calendar, when it's actually 1935 by Gregorian calendar, during the Italian invasion for second time in Ethiopia, and just prior to the Second World War. So during the occupation of the 5 years of Italians, they established the old building that I've showed to you previously, as a field hospital for the wounded Italian soldier by Ethiopian patriots in Hararge mountains. So after that, it came under the government. Then in July 2010, the Haramaya University hand over the hospital from the regions, the Harar regions. So in the past 16 years, it was under Haramaya University. So through that, over 2,000 physicians or doctors have been graduated from this hospital, and over 100 specialists have been graduated. So we have thousands of health professionals that have been graduated in the last 16 years of the medical school from this hospital. Now it has been rebranded and upgraded the status from general hospital to the comprehensive child hospital, providing specialized service with being a pool for the pool of physicians in Harar. We have over 110 specialists and subspecialists in the hospital, over 400 nurses, and over 60 pharmacists, 50 laboratories. So in general, at the hospital only, we have around 1,200 staffs. So with that service, we have operated 35 clinics in the hospital with 20 departments, 20 inpatient service, and 500 inpatient bed capacity with existing facilities now. So with our vision of being a leading hospital nationally and a recognized hospital at international level by providing high quality medical service, medical education, as well as evidence generation in the field of biomedical areas. So Haramaya University started that the facility that we have, the already the talent build it and the extension after that, that's not enough. So the university started building a mega hospital that we are in now, which will be, well, after its completion, it has 1,000 bed capacities, will be the largest hospital in Ethiopia. With that extension, the Alibra Memorial Cancer Treatment Center also born with that extension with the universities. So being a sector of medical excellences in the medical teaching, in clinical service, as well as the researchers, biomedical research in the Horn of Africa, and also by the type of medical tourism. So the hospital overall, we provide around over 300,000 clients per year. Last year, at the outpatient visits, over 20,000 inpatient inpatient service, and we have our separate emergency centers in the center. So that is annually around 20,000 people. As the center is the interiors for Ethiopia, there is high trauma, vehicle accidents and injuries. So that to accommodate that, we have our own standby ambulance centers with toll-free call, so that people around the Hara and in Eastern Hararge can call and use it.
How does Dr. Artist Ali Bura Cancer Treatment Center fit into the broader context of medical tourism in Ethiopia?
You know, medical tourism means people come from various parts of the world to get medical care. You see, Harar it's found in Harar. It's a historical city. There are a lot of tourists that come from other purposes. So Halibra the Cancer Memorial Center was it will be one of the sites. It's already being serving. So because of the historical region as well, and because of the technologies and the service it has, in Horn of Africa, it is being serviced aimed to serve as one of the tourist destination regarding the medical provision in providing comprehensive cancer treatment care. That comprehensive means including the surgical service, the radiotherapy service, the chemotherapy service, the hormonal therapy services, the social support groups, palliative cares. And so by and diagnostic service as well, by providing all the service, it will be it will be the center. It will be one of the leading center in hosting medical services that travel to Ethiopia. And so it is to realize that this mega hospital project is being built by our university.
How does Dr. Artist Ali Bura Cancer Treatment Center contribute to advancing oncology practices in Ethiopia?
As you know, the center is one of the unities in hospital, a teaching hospital, so that it shares the three missions that we have. One is advancing an excellent medical education, providing excellent medical education and graduates both in the fields of clinical oncologists that we are planning to start as a residency, and the medical physics related therapy professionals. So we generate the provisions, and also we provide to the standard state-of-art care in cancer care for the new generation. So the graduate we produce is those who will treat the next generation. Okay, so we do that when we do, and also we have planned to have center of excellence in research and evidence generations, and so our center is providing different trainings for short-term trainings, also long-term trainings. Actually, as a academic program, we're going to start our planning, but we have capacity building. We made capacity building with extension in the nearby facilities in city of Dredao City, in Jijiga, as well as in Hararges.
Would you show us this Dr. Artist Alibora Cancer Treatment Center? Can we visit? Yes. Thank you very much. Let's go. Dear our valued viewers, we are now at Honorable Dr. Artist Alibora Cancer Treatment Center. I will have some discussions with doctors working on this area, and I will also show you the workers that they do here. Stay with us. I will have also some discussion with patients who have come from different areas around the globe. Till the end of our program, stay with us. Hello, doctor.
Hello.
Nice to meet you.
Nice to meet you too.
Would you tell us about yourself, please?
My name is Dr. Michael Shaul. I'm an assistant professor of clinical oncology working at Honorable Artist Dr. Alibora Memorial Cancer Treatment Center. I have been a clinical oncologist for the past almost 3 years. So I am serving my community here in the eastern part of Ethiopia.
Nice. What treatments do you give for patients who have come to this cancer treatment center?
So we have been very lucky. We really give different kind of treatments. We are one of the 3 treatment centers all over Ethiopia which provide radiation treatment. So the first one is Black Line Hospital at Addis Ababa. The next one is Jimma University Hospital, and we are the third one, giving treatment like radiation all over Ethiopia. So we provide chemotherapy, radiotherapy, hormonal treatment, targeted therapy, and different types of palliative care treatment for our patients. So it has been a beacon of light for most patients here in eastern part of Ethiopia.
Nowadays, cancer has become, a silent killer. What would you tell us about this silent killer disease?
So in Ethiopia it has been very difficult because a lot of people think that when you say cancer it's like a death sentence. People doesn't think that cancer can be treated or can be cured and so on. So creating awareness has been the very core point of treating our community, teaching our public and so on. So what we did was, the first thing, since the establishment of this center, we have established different support systems, especially for breast cancer patients, for cervical cancer patients. And these patients, after treatment, they will go into the community and they will show that they have been cured from cancer, and they have been a clear advocate and a very good advocate of cancer treatment. So now people don't fear cancer as before. They are now trying to seek the treatment at our center, and we really feel that we are doing a good job in advocacy, in creating awareness about cancer and so on. Otherwise, most of the people in Ethiopia, even health professionals, doesn't have a first-hand information about cancer, and we really lack a good knowledge about cancer and its treatment and so on.
Do you think that the patients that come to this treatment center and get treated will be healed 100%?
100%, no doubt, no doubt. Our center provides every treatment. We are very unique, we are very fortunate. We are serving the eastern part of Ethiopia with zilch, with zeal and with happiness, and really we are treating a lot of patients. So I am 100% sure that we are curing them.
Thank you very much. Let's get inside, and as oncologists, you will show us what you do.
Yeah.
The work is that you do there. Okay, thank you.
We provide the medical oncology treatment like the chemotherapy, targeted therapy, hormonal therapy. Nowadays, even the most expensive treatments like immunotherapies, because some of our patients afford such kind of treatments. And the other one is surgical treatment. We do have fellows and subspecialists, even the surgical fellows and also gynecological fellows. So these surgeons and subspecialists also do the surgery for these patients. And we have been very fortunate to have this expensive radiation treatment center. So we provide also radiotherapy, and the radiotherapy even has different types of modalities. We call them 3D conformal radiotherapy, VMAT, and also IMRT. So the technology is very advanced. So we are also catching up with the Western society, and we are treating them with this very advanced treatments modality. So we have been very fortunate. to have such kind of treatments.
There are different kinds of cancer types.
Yeah, no doubt. Yeah, usually it is said to be
Can we know how many types are there?
more than 100. It is said to be more than 100. You know, cancer can touch anywhere, any parts of your body, from your hairline up to your toe. It can raise from the ears, from the nose, from the lips. We have different types of patients. You can see from our ward and also from our radiotherapy centers that we treat a lot of patients. The most common cancers are said to be breast cancer in Ethiopia, which accounts around 33%. Then comes cervical cancer, which accounts around 12%. Then comes colorectal cancer, which is the cancer of the colon or the large intestine. So these are some of the commonest cancer. Otherwise, we do have blood cancers, leukemia like lymphoma. We do have cancers raising from the nose, we call it nasopharynx, from the oral cavity, from the lips. We have lip cancer. We do have cancer raising from the conjunctiva, from around the eye. So we do have a lot of different types of cancers. We see especially kids with a growing bone. So they will have bone cancer because, you know, cancer is like those cells which should grow will be out of control. When the growth and the size of those cells becomes out of control, it will become cancer. So these kids, especially teenagers, will have osteosarcoma, which is the cancer of the bone. They will have different types of this kind of cancers from the soft tissue and so on. So we do have a lot of types of cancers.
So for which type do you give radiation?
So usually in our setup we do provide radiation for cervical cancer, for breast cancer, and for head and neck cancer, for head and neck especially nasopharynx, oropharynx, the oral cavity especially for those who are smokers and so on, they will develop cancer from the oral cavity. So we will provide them with radiation treatment. And for women especially, they will develop cancer from their pelvis area, from this cervix or the vagina and so on. So we provide also radiation treatment for that area, and also from the anal, or from the anus, and also lower intestine, like from the large intestine, like rectum and so on. So we do provide radiation for rectal cancer and also anal cancer too. This is one of our office. We call it, this is the contouring room. We call it contouring room because we contour the disease. Okay. That's why we call it contouring room. For example, this is one of breast cancer patients. After surgery, the surgeons did a good surgery for her. This is a left breast CA patient, left breast cancer patient. So the left side was done with surgery. You can see from this image. So this is a CT scan which was done from the CT simulation. The CT simulation was done by the radiotherapists and also the radiation oncology nurse. They will send the image for me. After sending the image, I will see where the disease is. Fortunately, this patient, the surgery was done for her by the surgical oncologists. They did a good surgery, and after that, she needed an adjuvant radiation treatment, which we call it radiation. So after that, this is what we do. We will contour every disease from the chest wall. So this is the chest.
Which one is the disease now?
The disease mainly is being treated this one. Yes, yeah. Okay. So it's different. For example, after contouring the disease, we also contour the organ at risk, the other organs, like for example the lung, the heart will be contoured, because we will know the exact dose the heart got, the exact dose the lung got, because this treatment planning software, the software will give you the advantage to know every detail. You can't miss, when you give radiation, you can't miss a millimeter. So this treatment planning software is well equipped to know everything, every detail from this imaging. So this is one of our breast cancer patients.
I want to show you something. This machine is very like in other name targeted therapy, the other name of this machine. When you say targeted therapy, you're going to treat the area which you are targeted. You see? So, to target or to treat where the area of the treatment, we need some kind of mechanism, targeted mechanism. If you can see like this kind of leafy things, these are called MLC, multi-leaf collimator. As I told you before, when they are contouring the area of the treatment, these are the materials which spare the normal healthy organ from the cancerous organ. So by using this one, this MLCs, we're gonna spare the healthy organs. So the area of the uncovered parties where the target, where we give the radiation. So by help of this MLC, we're gonna isolate the normal healthy body parts of our organ. So we're going to treat the targeted area of the tumor. So the best part of our treatment machine is like the MLC. What I hold in here is called TLD. This is which I going to measure how much radiation did I exposed myself. So there are physicians who going to measure this and inform us how much we measured with the millisievert. How much millisievert of radiation do I exposed? But the room by itself isolate most of the radiation. When you come to radiation treatment, we have 3 types of rule. Time, distance, shielding. We call it the golden rule for radiation. By that rules, we're gonna protect ourselves. This corridor is called maze. This is where we enter and we're gonna out. So it's called, the name of this room is called bunker. You know, the aim of this is to control the radiation inward, not out. And also, this is the buttons that we control the doors.
My name is Tara Wilfong. I am a full-time staff here at Haramaya University in the College of Health and Medical Sciences. I'm a medical doctor and public health practitioner. I've actually lived here in Harar for over 5 years now. I originally came as a Fulbright scholar from the US and have lived here. I never left after the Fulbright scholar ended. I stayed on as full-time staff at Haramaya. I'm, like I said, a public health practitioner and also a medical doctor. And now I work mainly in public health. I'm associate professor in the department. And I'm also the International Collaborations and Liaison Director. So I help write grants, I do research, I do my own research, and I teach in the public health department. And I help with the Cancer Center. I've been working with the Cancer Center for almost 2 years now. I help them write grants and help work with collaborations and help with international partners and things like that. I've been working with the breast cancer support group now for a little over a year. So I basically help them write grants and work with international collaboration.
What milestone achievements you have registered so far in applying the knowledge and the skills you've got from your country in Ethiopia?
We've been fortunate to have the Cancer Center here. There's only several in the whole entire country, but there's still a lot of gaps. But starting the breast cancer support group was a big accomplishment, and continuing that. So hopefully we can sustain that. It's been a huge support for the people living with breast cancer and the survivors of breast cancer. As October has ended, October is a big month for breast cancer awareness. We need to continue it throughout the year, not just breast cancer, but cervical cancer, other cancers that are affecting women and men. But breast cancer is the #1 breast cancer we see here, especially in women, but we see a lot of liver cancer and other cancers. But we need to increase awareness of cancer in the communities and also with healthcare providers. There's a big gap in knowledge and awareness of breast cancer, and that prevents people from coming for treatment. We're fortunate here in the eastern part of the country that we have a cancer center here. For many years they didn't, but now we have treatment. So they have access to treatment. They have great healthcare providers. It's by far one of the best healthcare teams that I've worked with. the oncologist here and the general practitioner, so they're very fortunate. But, so I'm trying to help bring collaborators and grants, money, and knowledge to this center and to other units in the hospital, and just help them increase awareness about cancer so we can try to get treatment for people earlier. That's the key, is to whether it's breast cancer or cervical cancer or whatever, is to get people here earlier so we can treat them earlier so we have better outcomes. But cancer is treatable. We just need to treat them earlier. That's really the key.
Thank you very much. Any message you want to forward for people watching us?
The biggest thing is that, again, cancer, whether it's breast cancer or cervical cancer, is treatable. The earlier you can get in, the better outcomes. So if you have any concern at all, go to your healthcare provider and have something looked at if you're concerned. And for women, they need to start doing self-breast exams at a young age. Early 20s is not too young to start doing self-breast exams.
My name is Abdulsamad Suleiman R. I come from Hargeisa, Somaliland.
My name is Naratab. I came from Eritrea, Mandagara.
So I brought here in Harar for my father, who was suffering a cancer. Then that's why I came here, Harar.
How did you come to Ethiopia and to this center?
I came with my sister, my elder
You
sister.
brought his sister
Yeah,
to this
my
cancer
elder
center?
sister. Yeah, she took chemotherapy and some surgery in Eider, but it's not enough there in Eider. They wrote us a referral letter to HiwotFana hospital here. We gathered before information about where the radiation treatment is available. People told us there is here in Haramaya University, Addis Ababa University, Black Lion Hospital, and Gondar. But when we compare which one will be suit for us, here HiwotFana was chosen.
Did he get the treatment?
Yes, he got treatment. He got good treatment. He had 30 days of radiotherapy and 4 days of chemotherapy. That process is called concrete process. He done everything right now.
How is he now?
Now he's feeling better. When I compare how he was previously and right now, there is a big difference. I really see this a good opportunity. So I have also half of my family, they live in Ethiopia. Then I made a research before I arrived here in Harar. Then that's why I got the information in here HiwotFana hospital in Harar region.
I appreciate them. The environment was very new for us, even the people. We came by asking even the direction. So as we arrive here, they accept us very friendly. Then after that, the third day, we start the medication. We start the treatment. So thanks for all the staffs, for the doctors, for the nurses. They all support us. They respect us. They interrogate us. Even they pass through the ward. Is there any problem? So thank you very much.
They ask if there is any problem.
Yeah, is there any problem? Why can I help you?
If you have a patient who has cancer, you have to bring him early. He is curable and he will have his life again.
Dear viewers, we have been together observing Dr. Artist Alibura Cancer Treatment Center, the workers they are doing here, the patients who have come from different countries around the globe, especially from Somaliland and Eritrea. There are also other patients that we didn't meet today. Thank you for watching and being with us. Stay safe.